Hi, I'm Ron Wineholt, Maryland Chamber of Commerce, and I work on healthcare issues. Everyone's following the healthcare debate at the federal level, and we're following it especially closely here at the Maryland Chamber, along with our friends at the U.S. Chamber of Commerce, to sift through the details and figure out what it means for employers. There is, of course, a House bill, which is the product of the work of 3 committees in the U.S. Congress, which has provided their product and will probably be voted on sometime in September. And there's a Senate bill, which is the product of 2 committees' work in the U.S. Senate, which is more of a work in progress and a little slower coming along. We agree that employers and employees cannot afford to have the cost of health insurance double again in the next decade as it has the past 10 years. Therefore, we think federal legislation is appropriate to help control costs, and we think something's probably going to pass this year, and it's important that it be right and not something that just passes more costs on to employers. Unfortunately, the legislation as it currently stands in the House and the Senate all too much does seem to pass more mandates and costs onto employers, and there are several things that we want to call to your attention that we ought to focus more on and communicate to our U.S. senators and representatives. First, the legislation in many respects would require minimum benefits for a qualified employer health insurance plan. That's a concern because you'd have, in effect, a layer of federal mandates on top of state benefit mandates as well, and that could mean more costs for employers. There would, in the legislation in both the House and Senate bills, be minimum employer subsidy levels for health insurance, anywhere from 60% to 72.5% subsidy required for employee health insurance. And of course, that could increase in subsequent years as well. The bills would require that health insurance benefits for retirees could not be reduced unless similar benefits for current employees would be reduced as well. That's in the House bill. And of course, there would be new taxes and assessments for employers, which is a major concern to us because if employers become in effect the deep pockets for paying for more benefits, those taxes could go up and up. In the House bill, it would be an 8% payroll tax on employers. In the Senate bill, a charge of $750 per employee. In each case, if the employer did not provide a qualified health insurance plan. And under the House bill, there would also be higher individual income tax rates that would fall disproportionately on small businesses such as sole proprietorships, LLCs, S-corps, and in the case here in Maryland, when you combine it with the state income tax rate, employers would actually be paying a majority of their net income to the state and federal governments. And then finally, of course, the highly controversial public option or government health insurance plan that, again, we're concerned would pass more costs on to employers. So it's very important that we stay up with what's happening on these issues on health care. We're having a couple of forums on this in September. We hope you can attend them. But in any case, stay tuned with the Maryland Chamber for more health care updates.